Hi, my name is Michael Galinsky, and I'm a filmmaker. I've made a film about Dr. John Sarno and his mind-body approach to medicine. And in the course of taking that film around the world, I met Rose Hoey in Australia and Dr. Tova Goldfein in Israel. And together, we decided to pool our resources and work together to spread the message of mind-body medicine.
So I'm Dr. Tova Goldfein, and I've had the privilege of helping many, many people in chronic pain and with autoimmune disease take responsibility and live a quality life. And like Michael, I've had the privilege of studying Dr. John Sarno's methods, along with many other doctors that have taken the methods a step further. The movie All the Rage is a blessing, is a mitzvah, and it has helped thousands of people manage and come out of chronic pain.
My name is Rose Hoey. I'm an ISTDP psychotherapist and a registered nurse, and I have the wonderful privilege of spending time with patients, helping them to see what they don't want to see, the issues that have hurt them for so long. We are doing this show because we know that you can heal too.
Exactly. So together, weekly, we come on with therapists and doctors and movie producers and people that have self-healed from chronic disease and from chronic pain and autoimmune disease. And we hope to continue weekly meeting you and educating you and helping you self-heal. Shalom. Here we are all over the globe. It is a balmy, warm night here in Israel. It is 10 o'clock, and I'm always happy on a Monday night to hang out with my co-host and professional partner, Rose Hoey. What's going on down there at 5 in the morning, you brave soul?
That's right. This morning, we have got Jim Prussack. He's a physical therapist or a physiotherapist, depending on where you are in the world. He's also got extensive research background in healing chronic pain. He's worked all over the world, studied all over the world, even over here in Australia.
That's right. Beautiful place. Love Australia.
Thank you. Jim, first of all, give us a little bit of your background, why you became interested in chronic pain and the frustration that it caused you initially, dealing with patients that didn't get better. And then tell us a whole lot about somatic tracking, or as others would say, sensing your whole body.
Yeah.
And if you think about it, this is about turning inward. We often in the world turn outward, but the way Jim brings it to us is we look inward into our own selves and what's actually physically happening in our bodies. So welcome, Jim, and thank you for taking the time to be with us and sharing your information. Thank you.
Yeah, thank you both for putting this on. Like I said to you earlier off air, I said I think it's amazing what you're doing and just spreading the knowledge and word that we need to keep spreading, because it's not quite mainstream yet, right? And people aren't always taking this on, and doctors aren't always talking about this. So we need ways like this to get the word out. So thank you very much for having me on. I am a physiotherapist, or what we call physical therapist in the States. And I've been practicing for over 20 years, about 22 years now. Can't believe it. And I started out just as a regular physio, working with pain, orthopedics, neurology, outpatient clinics for many, many years. And what happened was, about maybe 7 or 8 years into my career, I started seeing a lot more chronic cases of chronic pain. And I started to wonder why I wasn't a good therapist anymore. I'm like, why aren't these people getting better? I learned all these manual therapy techniques. I did so much continuing education. I was just an avid learner. I just wanted to help people. So I was always learning and always trying different things to help people. And I just had sort of questions that were popping up in my mind as to, I was doing techniques, people weren't getting better. And so it started raising questions, and I started looking for answers. And so what happened was I ended up traveling over to Australia, Rose, where you live. I went to Perth, Australia, in Western Australia, and I spent a year there studying under some great people. I learned about the biology of pain, and I studied with a gentleman named Peter O'Sullivan, who's a physiotherapist. and he's really, really good. He has a lot of research on the back, and he has an approach called cognitive functional therapy. So it combines sort of like a physiotherapy with some cognitive work and belief work. So it really opened my eyes to chronic pain. And so I came back with this new evidence and new training. And then from that point on, I just really started accumulating more knowledge. I had, reached out to Dr. Sarno when he was alive, and he pointed me to Dr. Schechter because I live in San Diego on the West Coast. So I went and saw Dr. Schechter in Los Angeles. Any of you know him? He was great. He kind of was kind enough to have me come into his office and let me see some patients with him and kind of explain what he does. Yeah, he was great. And so from there, I had gone from Dr. Schechter to another Dr. Schubiner, who many of you know, in Detroit, outside Detroit, Michigan. So I spent a couple of days with him, with Howard, got to know him pretty well. I've been back there a few times. Also amazing. Learned a ton of stuff from him, watched him work with clients and patients. So I just started accumulating a lot of this information. Became a SERPA practitioner with Georgie Oldfield in the UK. So trained with her. I've been over there a few times. So I just was like trying to absorb and like a sponge as much as I could. And what I basically found was I started throwing away a lot of my physio-mechanical approach. I mean, I couldn't help it. I started like having to put that aside because what I was seeing wasn't making sense from a mechanical standpoint. It just wasn't. And it was making much more sense from this sort of biopsychosocial approach, looking at the psychology, looking at the brain, looking at the nervous system. And so that's kind of where everything unfolded for me and to where I am now. So I came from working in an outpatient clinic, continued to work there for a number of years. And then I just said, you know what, I got to go on my own because what I was teaching and what I was talking to people about wasn't really aligning with the practice I was in. It was just purely like 15 minutes a patient. You couldn't really do much with people. So I started what I call the pain PT. And it started out basically of just working with people locally. I had a client from Dr. Schubiner that he sent to me, and he said, hey, you should start a YouTube channel. He said, you got all this great information and you should put it out there. And I go, okay, I don't really go on YouTube very much. I'm not a very tech savvy guy. And so he just like, I'll help you do it. So he helped me actually get started on it.
Really?
And I just started first, like putting mostly, if you go back to my old videos, it's a lot of evidence-based because I'm very much as a PT, medically trained, and I want to back up what I'm telling people. I don't just want to have some airy-fairy kind of information. I wanted to back it up with science. So I put a lot of science into it, and I still do because I believe if we can legitimize what we're doing here, it really adds a lot of weight to our work. Okay, we're not just making this stuff up. There's actually real science behind it. So a lot of my work comes from that. And then I just try to bring this holistic approach now to working with people, really looking at the mind. And, that kind of led me to the somatic work, like you're asking about, Rose. Really how that came to be, honestly, came from my background in meditation. I had done many years of Vipassana meditation, which they call insight meditation. And the training in that is that you go inward, you go into your body and you are just feeling what's there from a very neutral to open place. And you're learning not to react to it or resist what you feel, essentially. Now, doing these trainings were really intense. It wasn't like you went for an hour or 2 hours. It was a 10-day silent retreat where you go into it and you say, talk to people and you say, all right, I'll talk to you in 10 days. And
I
then
wonder
literally
if that's a new treatment. Think about it. Like it's the discipline of being with yourself, because that's when most people we talk to, isn't it true that if they're with friends, they don't think about their pain, but if they're with themselves, it's exaggerated. Wow.
100%. There was nowhere to hide. There's nowhere to go. You literally sit with yourself, and I learned so much from it. It was like I've run marathons. I've done a lot of physical stuff, and this was the hardest thing I've ever did in my life. I mean, people were breaking down, people were crying because stuff is coming up. And the only thing I'll say about it, which wasn't great, is there's not a lot of guidance. It's sort of like the old spirituality guru technique where you have to figure it out on your own. They're going to give you just a little bit of information, and then you have to kind of they want you to come to your own realization. So it was difficult because you're like, what's this coming up in my body? What's this feeling? What's this feeling? And, after 10 days though, my life was different. I mean, I walked out of there a different person. It wasn't like my journey was over, but it certainly was on its way, because you can't help but have some shift in 10 days of a silent retreat where you're sitting 8 to 10 hours a day, meditating. So
And
one of
And
the,
little food.
yeah, I
Yeah.
mean, one of the biggest things I learned from it was
the
just sitting.
dietary.
Yeah.
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 And just people say, you can't sit for that long. I would sit for 10 hours a day and have pains in my hips, pains in my back, because you're sitting in that sort of like cross-legged position, which is uncomfortable for a lot of people. And it was for me. But what I found was that the longer you sat and the more days I sat, the less pain I had. So it was quite interesting and went quite opposite from what we would think, that, you should be feeling more pain. So as the mind
Jim,
settled, the body settled.
okay, could you also tell people a little bit about that, within that time, how your mental life changes? Because it's a very life-changing experience. I haven't done it, unfortunately. I've booked it in, and then
Yeah.
I wasn't able to go because of COVID. But
remember, you were heading to India, Rose.
sorry?
You were heading to India, weren't you, before Corona?
Yes, yeah. Jim, would you, for a moment now, because you've talked about the movement of the pain, but also can you tell us a little bit about the transformation, the fact that worry wasn't so important, that sort of thing, and
Yeah.
that thinking about the future wasn't so important, because you had to be just in the present for those 10 days, and
Yeah.
how healing that was. Because although not many of us can do this, we can get a bit of insight about our defenses and how we actually anticipate problems that are going to happen that haven't even happened, or looking at an old pattern and expecting the new pattern to be the same.
Yeah.
So would that have been a very important part of your
Absolutely. Yeah.
transformation?
One thing I'll say up front is I don't think that you have to do that to heal. I still let people know. I don't want them to get the idea they have to go away for 10 days to heal.
No. But
But
it's so
it's,
wonderful. It's not just the pain, but the whole outlook
it's,
changes.
it's,
Yeah.
we'll go over some practice. I believe, looking at it now, the outlook is the most important thing, because what's happening in your
Yeah.
body is already happening. Okay. So it's your perception of that is the most important thing, to be honest. How are you perceiving what is happening in yourself? And that's right. So you wanting to come from a place, especially with TMS or mind body or PPD, what we call it. Once we've ruled out there isn't anything structural or physical, then we can put this into place, because we can essentially say, hey, a lot of the stuff you're feeling in your body is being produced by your brain through your nervous system. It's nothing structural. It's nothing sinister. So that's our foundation or groundedness we can come from for the mind place to say, okay, I can sit with this and let's explore this, maybe out of a curiosity versus being concerned, maybe out of an openness versus being closing down or shutting down or fighting against it or resisting it or reacting to it. So yeah, that mental space is really, really important to be in that space when you're going to go explore into your body, because you may feel a lot of uncomfortable feelings, right? When we go inward, and a lot of people don't connect with their bodies. They're cut off from the neck down, and they're just living up here, and they're just going around in their heads. So that was a big thing for me, because I was always had like a very active mind and still do, but it had such an impact on me that my mind slowed down. It really did. There was like some separation, some space there where I could actually realize, hey, I'm not, these thoughts, and I can observe these things in my body. I don't have to be taken away
Yeah.
somewhere else. So that present moment.
The beauty of this is as in the presence process or any of the books, Be Here Now, The Power of Now, when we stop and are in the moment, wouldn't you say, Rose and Jim, that would be a little bit of a taste of a 10-day retreat? Because as we try to be in the moment, you're breathing. That's, help me here.
I think, I think in a way that when you've got a very bad sciatica, for example, you're not thinking about the moment, you're thinking about the sciatica. So the way Jim presents it, then we start doing this somatic tracking, which then allows the person to not just think of the hip or the leg, but think of the whole body. So
Yes.
yeah.
Somatic tracking is what you're saying, is this opportunity to have your 1 or 2 minute retreat in the moment. That's the beauty. You're bridging between the silent retreat, looking at your anxiety, being able to be compassionate and accepting. And that's, now I'm realizing that's what somatic tracking or pain reprocessing is.
Yeah,
Beautiful.
you're reprocessing. I mean, really what you're doing is working in the brain, so through in your body. So we have symptoms in the body, right? And either symptoms that are produced locally or they're produced more centrally through the brain. A lot of chronic pain essentially produce pain, right? Sensitization in your brain. So we're actually changing your brain centers. When you attend to your body and you feel stimuli, you feel sensations, you feel your feelings basically, and you're changing the context or you're changing how you think about it or what your perception of it is, you are literally communicating from your frontal lobe to your temporal lobe. You're changing the dynamic there. You're changing the messaging. So that's why a lot of times when people do this openly and they're in that open neutral space or even positive space about what they feel, there's shifts that can happen because there's communication happening through your brain centers, and that causes a change in your body.
Amazing. Amazing.
So, yeah, I mean, there's a lot to it, and there's still a lot we're trying to understand. I think part of it, you're bringing elements of mindfulness, which we know is helpful for attending situations neutrally, and we know that dampens down pain. So when you can combine, let's say, mindfulness or awareness with the sort of understanding that you're not broken or damaged, that's a very, very good combination there for success. So a lot of times people will have mindfulness, right? But they may not believe that they're actually okay. They may not believe that their symptoms are not sinister or dangerous. So that's why it may not work as good with somatic tracking. So we need to kind of combine the ingredients to bake this cake. And mindfulness is the first step. And then the understanding of that what you feel is not necessarily dangerous. And you're reinterpreting it to be more benign, to not be as sinister what you're
So
feeling.
I stopped for a minute just because we have a few questions, and this is appropriate question from Debbie. Jim, how do you not give the pain attention when you're really hurting? Does that
Yeah,
mean you're an insensitive physical therapist?
Yeah. So I see a couple of questions coming in there. Yeah. So I did work with Lauren Ramosley as well. She asked a question about that in Australia. Yeah. He's another famous guy. I worked a bit with him and David Butler. Well, that's a great question. So no, you actually have, when you have pain, you have pain. I mean, you have something there. It's in your awareness. Now you can ignore it. You can look away from it. And I feel like there's a bit of both that you want to do. So like the first step is the understanding is what you're feeling, this pain, is it dangerous? Number one, is it harmful or is it just hurting? There's a difference between harm and hurt. So again, that's your perception, again, your cortex of how you're sort of filtering what you feel. Okay. Now, if you're going to tend to it, you're going to notice it. This is where you want to come from. You want to come from this communication that what you're feeling is fine. And you can even talk to it. You can say, you know what, this is not dangerous, a sensation, just a feeling. It doesn't mean something's necessarily wrong with me. We know that to be true. I mean, look at an amputee. It's a classic case of brain-produced pain where the limb's not there anymore. There's no danger there, but the brain's perceiving danger because it thinks, man, that limb's not there anymore. Why isn't it there? And it doesn't like it, so it gives the person pain. So part of it, I think what you want to do is spend some time attending to your symptoms, but in the way we're discussing today. And then if you're also coming from this premise that what you notice in your body isn't dangerous, you don't want to become hypervigilant about it. You don't want to overfocus on it, because if there's nothing wrong there, why would you focus all the time on it? So it's a little bit of both, a little bit of attending to it, and then having this ability to look away and separate from it and go on in your life and try to live your day. And then when you do come back to it in your mind, you're coming back to it in the right way of approaching it.
So you're suggesting the importance of being distracted from the pain. Is that what you're saying? Like
A bit, yeah.
You've got a pain in your back or your leg or whatever, and you continue to walk on it rather than rest it. Is that what you're saying?
So again, it comes back to like, okay, what's the problem? I mean, as a physio, for me, it's easy because I know my body pretty well. And I know if I hurt myself. And so I always tell myself, and I always also tell my patients and clients, says, ask yourself, did you hurt yourself? Did you have an injury? Does this make sense from a physical standpoint? And if the answer is no, close the door. I tell people, please close the door to this on a physical level. Otherwise, you leave the door open one crack, this pain is going to blow the door open on you again. And you're going to create a lot of doubt and negativity in your mind, which is going to amplify your pain. So so close the door. Your communication is no, the pain is not dangerous. End of story. And so you're going to sit with that understanding. Another way to think about it, and this has helped a lot of people, is it's like an old Western movie. You're sitting with, who's going to blink first, the pain or you? If you're sitting there feeling it, who's going to draw the gun? Who's going to blink first? So
excellent.
When you do this, actually, the main premise of somatic tracking, and Alan Gordon is taught it this way, and I've trained with him too, and Howard, is that the main purpose of it is to reduce fear around your symptoms. So that idea of like who's going to blink first, it's like, if there's nothing dangerous happening and what you're feeling is not a monster, it's just a ghost that will evaporate if you stare it down, and you can hold your space there in a very neutral space and you just sit with it and you don't let it get under your skin, set a boundary with it in a sense, it backs down. Now you may have to do this a number of times because that limbic brain of yours is programmed to come back with more of this because it thinks and perceives danger.
What's beautiful here is that, of course, Dr. Sarno said you need to believe that your pain is 100% psychological. And I remember after lots of people saw the movie many years ago, All the Rage, the first thing I'd say, but I didn't get any tools. I didn't get any information. And that's where Dr. John Sarno, God bless him, at 96 kind of stopped. And then, Dr. Hanscom and Dr. Truman are all taking it a step further, because you're now explaining, you're unfolding about exactly what it means when we accept. There's reasons, there's science, there's biology of belief, there's crushing the doubt. So
all these, I think, like everything I mentioned, is bringing all these elements in. And just like pain reprocessing therapy, which, as we know, been all the buzz lately with the new book by Alan Gordon, The Way Out. This is basically, learning to reinterpret what we feel in us as not being dangerous anymore.
Could we maybe do a demo?
Absolutely. I knew you were going to ask that. Yeah, because this is very experiential. So let's do a demo. And I would love to get the feedback from the audience here that once you guys do this, chime in and let us know what this was like for you, because it's helpful for everybody else to get a sense of what people are experiencing when they go through this. Okay, so maybe we'll take 5 minutes or so. Does that sound
Lovely.
good?
Perfect.
Yeah. Okay, so we'll start with a very general somatic tracking, which means we're not going to be looking for anything in particular. We're not going to be bringing up any memories. We're not going to be really doing anything other than just going into our bodies in the present moment. So like right now. Okay, so for all you out there, what we're going to do is, wherever you are, if you're sitting down or lying down, all I want you to do right now, you can close your eyes or you can keep them open. Either way is fine. Just don't fall asleep. You want to just direct your attention now, which is called your awareness or your perception, and bring it to what you feel in your body. I want you to notice right now what you notice inward in yourself, from your head to your feet as a whole body. What do you feel right now? What do you notice in yourself? What are you experiencing right this second, this moment? And I don't want you to label anything right now. I just want you to become aware, essentially, of what you do feel. And I want you to allow whatever you're feeling to happen, to be felt, to be experienced, to be acknowledged, just from the space of awareness, just from mindfulness. There's nothing you need to do, change, adjust, stop, fix. All you're doing right now is tuning into your body, inward to yourself, feeling what you feel as sensations. Everything we feel is a sensation of some sort. And if you notice yourself going up to your mind, if you feel a certain sensation and you notice yourself judging, becoming critical, becoming scared, worried, concerned, see if you can just let that go and come back to what you feel from a place of openness. Maybe send a little message to your brain to say, what I'm feeling now is okay. It's just a feeling. It's just a sensation. Okay, and you doing that is starting to reinterpret what you do feel. And maybe you're feeling pain, maybe you're feeling some kind of physical symptom, maybe you're feeling an emotion, maybe you're not feeling too much, maybe you're feeling pretty good. But whatever you do feel, just continue to open to what you notice. And I want you to let this unfold. Okay, so unwind, be expressed. So right now, I'm not having you tinker or try to like do anything to what you feel, but just let it keep unfolding. Your brain produces these sensations in your body. So let your brain express itself right now. Let it have a form of somatic expression in yourself. So what are you feeling, guys? What are you noticing in yourself? Just keep noticing. Keep your awareness broad. So if you do notice that you zooming in like a microscope on a certain area of your body, because maybe there's a pain there, see if you can zoom out a little bit and hold a broader awareness so that your pain or your symptom is held in this space. Now, the space is infinite. To be honest, the space is infinite. It's like the sky. Just have a broad awareness of yourself. So you're just in a feeling sense right now. You're in an awareness sense. You're dropping out of your thinking mind for the moment and dropping into your body. Okay, not judging what you feel, just feeling what you feel. So how's that going for everybody? Just keep letting things come up, letting things unfold. So it's like a bubbling up process. I call it like a bubbling up of what you feel. You're not controlling anything or even seeking a certain thing. It's just whatever's happening. In a sense, I say that you're giving permission to your unconscious brain right now to take over, to produce what it's producing. And those parts of your brain connect to your nervous system, which then connect to your body. So this is why we have feelings from thoughts. We have feelings from the limbic brain. We're just reinterpreting now as being okay. They're all right. So just give it one last little bit of awareness. If your mind wandered off, no problem. Just come on back. You're literally building a skill right now. You're building what's called mindfulness and attending to what you feel. All right. Let's come on back. We'll do maybe another one of these after, but let's just see how that was for everybody. What was it like for you guys there for Tova and Rose? What was
Do you
that like
think
for you?
that you're creating a new neural pathway? Is that what we're trying to do? We're now telling the brain it's safe, it's okay. The pain is a message, and I'm going to learn to respond to it. And that's now I'm making a new highway that I can, I don't want to dumb it down to say like it's a habit, but isn't this like the new neuro pathway?
Yeah, you definitely are. The science shows that, with mindfulness, they've shown that you get what's called an activation of your prefrontal cortex here. It gets stronger in some other areas of the brain. And what it does is it downregulates your amygdala, which we know is very, very a big piece of a lot of chronic issues. So when you get in touch with mindfulness awareness, yeah, you are shifting your brain centers completely. Yeah. And if you're sending these little messages in as well to say, hey, this isn't dangerous, this is okay, you're also down regulating that amygdala, which is the source of symptoms.
Good. So Debbie, we're supposed to feel our emotions. She felt sadness.
Great. I would say that's great. So because we're not
Yeah, right,
judging what we
Jim.
feel.
That's great. So let's talk about. Rose taught me there's no negative feelings here. So,
That's right. There's no negative feelings here. So that's exactly right. What you feel is what you feel. Now, this is interesting if you think about it this way. Like all pain needs to run its course. Even acute pain. Like if you broke your leg, let's say, and you had pain, You can take all the pain pills you want. You can put all the ice on there you want. There's a timeline for the pain. It's going to go away when it heals. You just have to wait it out. Now you can manage it with stuff, but there's a timeline. So in a sense, we don't want to stop the pain. It has its purpose. So with chronic pain, the difference is that there's not a danger in the body anymore, that it's a danger in the brain, which could be from emotions, or it could be from other things, or PTSD or trauma living on, or current life stressors, or whatever the situation might be that cause a danger response. So we're reinterpreting now to say, look, we're not in danger. And by default, if I'm okay with the symptom, my brain learns that it's okay, and it has a tendency to start to calm down.
So if
You know,
Debbie
it's
is, go
interesting.
ahead. Yeah.
The patients will say, well, when I sit on a particular chair, I don't have the pain. But when I sit on another chair, I do. Or if I lie a certain way in the bed, the pain comes. But then if I lie a different way, it goes. And I'm just wondering about somatic tracking in that instance.
Yeah, that's an awesome question, because I wanted to get to that point. So somatic tracking, once you've learned it, it's like any skill, right? You practice this maybe. The main thing I tell people is you want to take this wherever you go. It's in your back pocket. So ideally, you're not just using this as a separate practice that you do 5 or 10 minutes a day. You're actually using it in real time whenever you, like you said, Rose, you're lying down and there's pain, or you're sitting in a chair in pain, that you can do the same thing in the moment. Okay, so we can actually be operating in this world and doing this part-time, because we don't have to be thinking all the time. We want to balance thinking and feeling. Ideally, if we're complete human, we want to have emotions and thoughts, and being able to tend to both of those things throughout the day, right? That's emotional intelligence. So we want to use that. But, as you guys know more than anybody, we haven't learned that, or there's reasons why we don't connect to our feelings as easily because of things that happen to us.
Yeah, I wanted Rose to address Debbie's question, because we sort of think it's the feelings come, and then we're like, we're beaten. We're like, now what? I'm feeling what do we do now? I want to do something. I want to fix something. Tell me what to do with my sadness. Rose, can you maybe, what would you be saying to Debbie after she somatic tracked in your office?
Well, I'd say let it come up. What would you say, Jim?
I would say the same thing. We know emotions, when they're expressed and acknowledged, there's a timeline, just like pain. Maybe it's 5 minutes, 10 minutes, 15 minutes. Maybe it's like a grieving process, and maybe it's days.
Mm-hmm.
But essentially, yeah, once you feel the feelings, they would say, you're starting the healing process.
Yeah.
Okay.
Yeah.
Starting the healing process.
I want to address a few of Patty's.
Oh. Are we back?
Still here. I think Tova's froze up there for a moment.
She has, yeah.
Of pain symptoms.
Can you say that again? I lost you for just a second there.
What do you do for people with PTSD on top of TMS? My brain understands it all. However, I can't get over the anxiety of the pain.
Yeah, okay. Well, I'll just talk about it from this perspective. I know there's many ways you could address it, right? But basically, the brain, so that a limbic brain is probably overactivated. We know that from the science. And what happens is we know it overpowers the cortex. Now, the cortex is our rational mind, our thinking, logical brain. We call it the CEO. And I tell people, look, you're the CEO. You need to get your cortex communicating with your amygdala, so you don't get hijacked by your amygdala. You don't get overloaded. So a lot of times with anxiety, people get overloaded, overwhelmed, and then they get into that, emotional response, and they can't function, right? As you know, they just have a lot of different symptoms. And so the first thing I would say is communicate. You are safe, right? Logically, think about this. Come up with an evidence maybe why you're safe, and you probably have good reason. There's probably nothing really wrong with you in terms of a structural problem or a danger when you're sitting there. So that communication, start that communication and keep it going with your emotional brain. Okay. That allows you to have some response, and it also allows you to be able to sit with what you're feeling in a different way. Because otherwise, again, that anxiety, it's like a fog that comes in and it can overwhelm us. And then if we don't have any way of working with that, we can be pushed to a panic attack, I guess, at the worst case scenario for some people.
Yeah.
So here's another, Rose.
The idea of fear is very dominant, isn't it? Could you explore that a little bit more? Because it's the fear actually that drives the amygdala, that shuts down the neocortex. So then the patient then becomes activated in a way of either having those muscles on the starting blocks or flattening out. Can you explore that a little bit more for the audience so that they get a good feel from a PT sort of standpoint about what's actually physically happening to them, and then how the awareness and the presentness can actually diffuse it, because it doesn't actually clean it out, does it? It diffuses it back. It has like a timeline, as you said. So could you just draw that out a little bit more for the audience so that they'll get a good, strong understanding of where you're coming from?
Yeah, I think it's great. I think fear is number one. If I look at the emotional list, like the first thing I would say is fear. Could be fear of the pain, fear of emotions, fear of a million things, right? And so I like to differentiate between fear and anxiety, because real fear has a purpose, right? If you're going to get hit by a bus, you're going to jump out of the way. Or your house is burning down, you're going to get away real fast. But if you have real fear, you typically you're not going to be thinking about it. You're going to react in a second. You're
going to do it, aren't you?
Yeah, you're going to do it. You don't contemplate, oh, here comes the bus. Maybe I'll get out of the way. Let me give it another 5 seconds. Too late. You're going to be a pancake. So anxiety is that lingering feeling. It is fear, but it's I call it a false fear, or it doesn't. It's a perceived fear, so it's not a real fear. But it is real because it is producing the same chemicals in us. But with anxiety, we can work with it because it's not a bus. It's not a fire. It's a fire alarm, but there's no fire. So what it does to the body, what we understand about fear is that it really kicks off a whole bunch of inflammatory mediators in our system, fight or flight type stuff. And it really is worse. So some studies show, there was a study out of California in 2007 that they looked between fear and anger, and actually they said fear is worse than anger. If you had to pick between the two of them, you're better off being angry than scared. And so I use this to my advantage with patients. I say, look, to overcome fear, you got to get out of fear, right? I mean, fear by its nature is going to paralyze you. It's a flight or freeze. Okay, so you're going to get stuck. Mm-hmm. So one way to get out of fear is to shift the emotion. Do you like fear? Who likes fear? Raise your hand if you like being anxious. No, you don't. So you have to tap into that part of you.
But I need it. It's like my friend.
Right. Well, I mean, if that's your friend, that's your friend. Now you can see it that way too. That's a great way to say it. So one way to overcome anxiety is to make friends with it, because it's not dangerous.
Good answer.
You just have to sit with it. So for me, anxiety was one of my main symptoms growing up. A lot of anxiety, which now has gone way, way down, because I see anxiety completely different. I know what it is. I'm not scared of it. Okay, so the anxiety is not the problem. It's the fear of the anxiety.
So
it's the fear of the fear.
I'm going to quote Howard Schubiner, because, I had to wrap my head around this a few times, because it's almost like an oxymoron. It's not the fear, it's the experience of the fear. So it's not my pain, it's my experience. So therefore we get to take responsibility, but that's like right. Not enough for some people. And I know it's not hard. This is not easy stuff. But if it's the experience of my fear or the experience of my anxiety, dive into that a little bit for some of the listeners.
So that comes back to your brain. You said it right. So the amygdala, the limbic brain, produces the emotions. Okay, fear, anger, sadness, all the emotions. That's not the problem. The problem, again, is here, your cortex. What's your interpretation of that? Our interpretation usually is, like you said, negative emotions. They're not negative, but that's what we've learned or what we've experienced from either our upbringing or how we look at emotions. But we need to shift our perception and interpretation of what we feel. That's what allows you to get your communication going between your neocortex, or your prefrontal cortex, and your amygdala.
The
You know,
interpretation.
Jim, when you have fear, it's risen out of a threat, isn't it?
Right.
Yeah.
So the threat, and you're exactly right, but the threat can be real, and that's real fear. Like I said, your house is burning
That's
down,
right.
or let's say you had a car accident or you fell and you had an injury. Okay, there's a real danger. Okay, but a lot of the time, this is there. It's like saying there's a lion, and it's really just a mosquito. It's biting you.
Mm,
Fear is
yeah.
not necessarily real.
Mm. But part of the fear is an internal fear, isn't it? It's a fear of our feelings.
Fear of the feelings, right? Exactly. So fear is a feeling, anxiety is a feeling, and then, like you said, there's other feelings that may be underneath fear. Because whatever we're afraid of, we will typically avoid. So that's the other piece I didn't mention is fear avoidance is a massive piece in this. In physiotherapy world, that's the one thing some physiotherapists are aware of. It's called fear avoidance, where we avoid the very thing we fear. And what that does, it just makes it worse. I tell people the world
Exacerbates
shrinks
it. Yeah.
down. Yeah. So
Yeah.
the way we fix fear is not to worry about the fear, is to exposure and to expose the very thing that we fear, whether it's an emotion, a deeper emotion like
Yeah.
anger, or an activity, or it's touch, or it's a food. So the exposure, graded exposure, is massively important, I believe, to a lot of people getting it back, especially people who have stopped so many activities, who've changed their lives and molded their life around whatever they fear. Meaning they're avoiding these things, they're paralyzed, they're stuck. So we need to get people
Mm.
re-engaged from this idea that there's nothing wrong with the fear, it's misplaced. You can go back to gradually doing your stuff again.
I think Dr.
Could we
Schrubener.
now?
Oh, go ahead, Rose.
Could we go back now to who was it over here on our talk? Who said
Patty?
about the sadness coming up?
Yeah, Debbie.
Could we now actually now look at that and how sadness, once that she did the somatic tracking, sadness came up. So that would have been her fear, wouldn't it? Her
Well,
fear of sadness showed up in
yes,
her, and she was able to cope with it because of the somatic tracking. She was able to relax the rest of her body, become aware of it. Sadness came up for her. We're not looking into why the sadness or whatever, but what we
right.
are looking at is the fact that that somatic tracking enabled that fear that sadness to show up. Could
That's
you
right.
sort of help Debbie sort of see how wonderful that is in actual fact? I know
Yeah,
it
no, that's
sounds
great. To
weird to
me,
say.
like I said, it was great when I answered it right away because
Yeah,
she was able to have that experience. Maybe she didn't have any anxiety in the front end. She went right to the sadness, which is great. Now, some of you might feel anxious when you do this, or you might feel that fear, which is what, a sort of a tingly, sort of nervy feeling, kind of jump out of your skin feeling, a comfortable feeling. So if you can just sit with that and be okay with that fear, a lot of times, like Tovi mentioned, it'll start to burn itself off chemically. If you're not reacting to the fear, you're not injecting your body with more fear. So that whatever that initial fear was you experienced starts to settle. It's like clouds kind of parting, and then there might be behind these clouds some other feelings that start to make their way into your awareness, and that's fantastic. So whatever you do feel, keep feeling it. As long as you know you're safe, which you pretty much are when you're just sitting with yourself. um, you're just building what we call affect tolerance, the ability to feel more, and your window of tolerance gets larger so you can handle more intense feelings.
yeah. Could you expand on affect tolerance? Because a lot of people don't realize what even the word affect actually means. Not in
Yeah.
mind the whole affect tolerance, because it's another important um, passage, should I say, to healing, isn't it?
Yeah.
Affect tolerance. Yeah.
Yeah. Just emotion, basically emotional feelings, that you build your ability to tolerate emotions, uncomfortable emotions. Okay. So any flavor of that could be, anxiety, and then it might be some kind of anger, it might be some flavor of sadness or disappointment, shame, guilt. It's very interesting when when you start to feel your body, these emotions are feelings. They're actually happening in your body first. Studies show that whether you live in Asia or you live in Europe, we feel emotions in the similar parts of our bodies, meaning it's universal to humans. And a lot of times we're disconnected again from our bodies, from our feeling sense. So we're just up here and we might be saying, yeah, I'm angry. Well, how do you know you feel angry? Well, I don't know. I just think I'm angry. And they may cognitively know they're angry, but they're not really in touch with anger so much. Maybe they're not feeling it at all, or maybe they're feeling anxious. But so it really depends. But having a label, you can label. So we didn't go into this in this particular somatic tracking session. What we just did was just very open, broad, without labeling, because I just want people to get familiar with the feeling sense. Mm-hmm. But it is also helpful for the audience to realize if you label the emotional word to what you feel, that also causes a reduction in your amygdala response. Okay, good studies show that when people could label what they felt, whether it was fear or anger, mm-hmm. brain scans show the amygdala response goes down. But if you label it with a different word, let's say in their study, they use the words Harry or Sally, like two people's names. If they attach that word to the feeling, the amygdala did not go down. And what they found too was that the amygdala is so responsive to emotion that when they subliminally put images on the screen that would elicit emotion and the patient didn't know, the amygdala is still activated. So what it tells us a lot of times is we're feeling emotion, but we don't maybe are aware of that.
We're not in touch of it. So here's two questions, one from Tamara and one from Jill, specifically about that.
What if you don't feel an emotion, just tingling or pain? Right. Yeah. So you know what? I find this fascinating too. I think a lot of pain, the way we describe the symptoms is describing the emotion. So the physical pain itself, when somebody tells me tingling, I think immediately fear or anxiety possibly. When someone says it's inflamed, it feels aggravated, it feels burning, shooting, that sounds like anger to me. It feels deep ache, that sounds like sadness to me. So sometimes we can glean just off the way people describe the physical symptoms, some of the emotion. One thing I'll add to that is that sometimes when you sit with your feelings, let's say they're physical or sensory in nature, like I feel pain, and you keep sitting with it and you keep opening it to it, and this has happened to me a lot with somatic tracking, is that it turns into an emotion. Yeah. Many times, right?
Well, that's what happened with Debbie.
Pain and it turns into an emotion.
The most important is if you don't have a feeling, then don't criticize yourself. It's not like you have to have a feeling because it's a test. It's like it'd be okay if you don't have a feeling, because at some point you'll get in touch with a feeling. It's like, and here's Jill's question. I don't want her to think anything's wrong, but maybe you could address that, Jim.
Yeah. So I think a lot of times what's interesting, if you look at the map of where people feel emotions, they say it's like from the waist up to your head, but really, if you look at it, a lot of emotions felt in different parts of your body. And a lot of people have, with this amygdala, what we're finding is that it can have a very broad reaction, meaning that you might feel sensations in different parts of your body. So the sensation itself may be emotional. Maybe you can even ask yourself, how does this sensation make me feel? As a starting point for somebody to just even connect to, let's say, a pain, and how do you feel about that pain? Now, sometimes I tell people just sit with what you feel. Don't even question it. Whatever's there is there.
Don't even look. Right. Just be there.
Just be there. Don't. Again, now you're thinking again. You're disconnected from feeling.
If you're as the leader, as like, right now you're getting the power. Like, okay, let me know if you have a feeling. So they're going to be like, I need to have a feeling for Jim. And then there's self-pressure. So it becomes like you're focusing on it. But please, I want a feeling. I want a feeling. What are you feeling, buddy?
You know what? But you are feeling something. A feeling is anything you feel in your body. And some people have this idea that some emotion is some kind of magical feeling.
Yeah.
No, whatever you feel is what you feel.
Numb is a feeling. Isn't numb a feeling?
Numb is a feeling. Now, anything you feel as a sensation is a feeling. And built into those sensations are emotions. We know the definition of pain. The actual definition of pain is a sensory and emotional experience. So they're intertwined a lot of times. Now, we can ask, why does somebody not feel emotion? Well, there's different reasons. One of them is alexithymia. I don't know if you guys have talked about that in your podcast before. Very real condition, studied pretty well. Alexithymia is this inability to express, feel emotions. And what they find in these people is that they feel a lot of pain. They feel a lot of somatic symptoms, but they're really feeling emotions, but they just don't have or haven't learned the ability to know this is an emotion. So then it's pain. So just feel what you feel. Just feel what you feel. Don't over analyze it. That's what we don't want you to do.
No, it's part of being a TMSer. We've all experienced that sensitive and strong. So Lori says, by just asking yourself how that symptom makes you feel, is that the way to find the emotion that's trying to come up?
Now you can. Now again, when I work with people with emotions more and more, I just, like I told you, that study that showed you how your amygdala went down by labeling the emotion. I don't want people going into a long story, especially when you're somatic tracking. You're just trying to feel what's there. Now maybe go, I feel sad. I feel anxious. I feel angry. That's enough. Just put a word to it and then come back to your body and just feel again. If it shifts, you'll notice the shift. You'll be like, ooh, now I feel something different. So just let it kind of unfold. You're really learning to combine labeling emotions with feeling emotions.
Yeah. Would you expand a little bit more also on the fact that a patient isn't able to verbalize what they're feeling, and draw that out a little bit more, because that's so important. And that would be part of what Jill is talking about just before. I watch somatic tracking videos almost every day, but she's not able to actually verbalize what it is that's within her. And would you just expand that for patients like Jill to see that that's being blocked here, as you said before, so we can gather all the information you've given everyone into a compact sort of understanding that this is part of the amygdala. The fear comes up, the amygdala is activated, and then silence. The fear is so bad that they become silent.
Right.
I shouldn't be. You're the expert.
I know. I mean, I would say from the somatic perception is we're trying to, get people to learn to identify, acknowledge, and express their emotions. Okay. So very simply, just like I said, labeling that. Now, I would ask her, maybe she can respond, is that she's feeling something in her body, Joe. Joe, how does that feel when you're feeling that? Even if you don't feel something different, what word comes up emotionally? If you have to use an emotional word most closely attached to what you feel physically in your body, what word would you use? Now, if it's anxiety, like you're saying, Rose, sit with that. It will burn itself off, and maybe a different emotion is behind that comes into your awareness. But a lot of people, I mean, I ask people all the time, how do you feel about this? And it's amazing. People just don't use the emotional word. They'll go on the story for another 30 minutes if I let them.
No, they go to a thought.
Yeah, I've had so many people
where
I'm
thought
like,
rather than a feeling.
So obvious to me, the emotion. I go, what's the emotion? I go, I know what it is. And they're like, what? Let's see, what would this emotion be? They're literally disconnected. And that's alexithymia. We know that 50% of people in chronic pain have this. It's very prevalent. It's normal, though. I want people to know that. Don't feel like you're some alien or something with this. This is very normal. It's why you probably are feeling a lot of chronic pain. It's just that you haven't been able to connect directly with your emotions.
Right. I wanted
and
to.
Often patients will, when they go back, they'll find that their trauma was very early on. And I mean, that's why attachment theory is so important, actually, in this type of work, because it's basically an attachment model that they've created to keep themselves safe. So just for patients to be aware of that. So
yeah. And I would tell people too, when you do somatic tracking, because you're opening up to your brain and you're opening really to your unconscious mind. So there's people that say that the saying, philosophers in the past say your body is your unconscious mind.
Right.
So what you feel in your body is your expression of your unconscious mind. Yeah. So sometimes what you're feeling now, because your hippocampus stores your memories, and that's in your limbic brain too. What you're experiencing now, maybe, like you said, was something from really a long time ago making its way up through your body, coming out.
Yep, shadow. Yeah.
So I wanted to address Patty. Patty, before we answer this question, Jim, Patty asked a few things in the feed. I'm able to see it. Would EFT help? Would hypnotherapy help? And I think what's interesting about Patty's pattern is that she's looking for something that's going to be like the magic. And the beauty of Patty, she's probably knows. I'm sure you know a lot because I've met you on the show numerous times. I'm aware that you're.
Am I the only person that's not frozen, or
I'm
is
not
every?
present.
Oh, you're not frozen.
No. She'll
I
come
think what
copy you back.
Tony's trying to. Yeah, yeah. In actual fact, for Patty, Jim, would you answer that, because it's such a lovely question to ask, because in
Yeah.
actual fact, she's looking outside herself rather than inside herself.
Don't breathe out. Yeah, and that's good. So I'll come back. I didn't exactly address that too when you had asked earlier about fear, what it does to you, and what pain does to us too. It is very physical, and we know we have constriction of blood flow. Sarno talked about oxygen deprivation. Well, that's one sign of a fight or flight freeze nervous system response, but we have many of them. We have muscle tension. We have guarding, we have muscle protection, we have shallow breath, we have contraction of the diaphragm. We have all these things that are going on in our systems that are a reaction to pain. Now, because pain biologically is uncomfortable, it's danger, so the body reacts. And so, yeah, your breathing will maybe get tighter, you hold your breath, shorter breath. So what I would say with that is starting to just calm down, relax your body first, because pretty much anybody who has pain, you have tension in your body, muscle tension. Now, maybe you don't. If you have some other symptoms, and Rose, you know this through your work, that maybe you're flaccid, maybe you don't have a lot of muscle tone, but a lot of people do have muscle tension, guarding, protection. So relax your body a little bit. See if your breath will naturally come down into your belly. Okay, because part of this is, as we're teaching ourselves what we feel is not dangerous, we're trying to also relax into what we feel. That's another way we can infuse to the nervous system that there's nothing wrong, is that we relax into something that's painful or uncomfortable.
Yeah. What else have we got here? You see, Jill was saying anger for dealing with the freaking pain. It's actually bigger than that, isn't it?
Can be a lot of mixed feelings, but she did identify an emotion, so that was good, Jill. And so I would maybe suggest to you that you sit with that. You mentioned anger, just say that word, see what that feels like to you inside, and let that burn through you, essentially. Let the anger be expressed somatically. So what we're talking about today is somatic tracking. So it's a somatic expression. It's our feeling sense. So anger has a certain feeling to it in the body. And if you can connect with that, let that feeling unfold, just like any other feeling. Feel your feelings and they'll start to subside.
Yeah. Could I also add to that?
The electricity went out.
Oh, so what happened?
I'm so happy you're back. Like, everything went dark in the whole street. And then I was praying and praying and praying, and the internet gods heard me. Oh, God.
We're carrying the torch here.
For your patience. So I was saying, okay, go ahead. I didn't mean to interrupt you guys. But I want to address Patty, that if you're still here, Patty, that everything works specifically for each person. It's not a science, it's an art. And listen, we say it all the time, when the student is ready, the teacher will come. So my heart goes out to you, Patty, regarding your wanting to know what works. Everything works. Jim, maybe, and Rose, you both want to address that, because I know Patty's struggling.
Yeah, I just addressed it when you went off a little bit about the body responds to the
I'll listen
pain.
to the recording. Go ahead. Yeah, good. Thanks.
Yeah. Yeah.
Thank you.
Is there anything else? We've talked about Jill with anger coming up. We've talked about Patty with looking externally. What else have we done? We've got a few. Okay, Tamara says she falls asleep. The longer I sit with it, I fall asleep.
Common. Can be a defense mechanism. It could just be you get sleepy when you slow down. Because a lot of people that if you're used to being busy all the time, this is like the worst thing to do. If I tell you to stop and just sit with yourself in your mind,
exactly, let go.
You're gonna shut down usually. That actually happened to me, just so people know, because my mind was used to be so busy that when I first started to meditate, I'd fall asleep immediately. Like I just had to be stimulated. So you're just teaching yourself to be aware. Now keep your eyes open if that happens. What I would say, keep your eyes open. What you're trying to do is be able to tap into your feeling sense anytime during the day. And especially if you're having an uptick of pain, that's a great time for you to check in with yourself. Okay.
Well, when you did that little 5-minute exercise before, the first thing I noticed was the tension in my body of actually sitting here doing this, and immediately my legs relaxed. I thought, really interesting, isn't it, that just by doing that tracking, my legs no longer needed to be held in tension. So I was going to run because, of the fear that sort of came up. So my legs became ready to bolt. But in actual fact, there's no need to bolt.
Right. You reassured yourself, right? And then you settled down. Same thing. Exactly. I checked in. I felt some anxiety too, because I'm the one leading this whole thing. And I could feel that anxiety in my body. But you know what? I'm 100% fine with that anxiety. It doesn't bother me. That's where you want to get to, where you don't want to be a slave to these feelings. You want to be free of them, right? Yes. So you want to get to that point where they don't need to control you anymore. You can just feel them and let them dissipate.
Yeah. And I think also just to utilize them as that they're speaking to you from your unconscious, that something needs to be sorted. That's all it is. There's something that needs to be sorted.
Yeah.
That's right.
It's simple and it's so complex. It's amazingly simple. And also after patients, the pain goes, they almost can't remember what caused the pain. And that's the other amazing thing about this, that once it's gone, there's nothing left. And it's sort of like
that's right.
Been drained.
Yeah, it's weird. Isn't it? It's like they forget all they even had pain. It's like, what?
Yeah, that's what I mean. Yeah, exactly. Yeah. Well, Jim, thank you so much. It's just been
we didn't
lovely.
even get to talk to Jim about everything else that he does, because I'm sure that he's got lots of other tricks up his sleeve. But you're suggesting that we have a silent retreat for 10 days. That's the biggest thing.
I don't think you have to necessarily do it. I really don't. I don't actually, to be honest, what I learned from that is in me. So I don't really meditate formally anymore, because people ask me that, but it's in my daily life now. So I can tap into it. But you want to it's like another tool that you develop that you can tap into when you need it.
Every breath.
Well, meditation's a wonderful thing to do. Yeah. And as Jim says, once you become a meditator, you actually have microseconds of meditation within your day when you give yourself space. Right. And that also allows people to actually allow a feeling to come up. And like if the feeling is anger or fear or whatever, they're actually able to address it in the moment.
Excellent.
They don't need to harbor it. And that's that spaciousness that our brain can give us.
So. I think that's what Dr. Hanscom thinks. He's so like gung-ho about journaling, and that's what saved him in his panic attacks. But he calls it mechanical meditation, which I think in the same way, when you're journaling and this feeling comes up, we could somatic track it and just accept it and watch it and see the journaling as a more beneficial tool in a way, and then what we learned in the presence process was every breath that I take, thank you, God, every breath I take is an opportunity for me to be present with it and to be in a meditative moment with my breath.
That's right. Yeah. Yeah, the somatic tracking, or I call it somatic expression. It's kind of like journaling, but your body's doing it. You're just feeling. You're connecting more of your feelings. A lot of people, when I talk about journaling, some have had a lot of success and some don't. And a lot of people are writing from their head, or they're writing stories. So you want to get to the heart of the matter, which is what the emotion. So you can slow down, maybe just connect with your body, so you can infuse somatic tracking with journaling. What am I feeling right now? What's this feeling around this? So you can connect more closely to the feeling while you put the label down onto the paper.
Yeah.
Amazing.
Well, our hour is up, folks. Thank you,
Yeah.
Jim. Thank you so much.
Jim,
And
amazing, just
yeah,
amazing information, and you explain it well, and just thrilled to have you. And I always say this at the end of every show: Rose and I are going to do this for a long, long time, so we're going to have you back.
Yeah, I'd love to come back. You guys are doing great work. Like I said in the beginning, really keep bringing on good guests. You guys got some amazing people already, so been awesome.
thanks, Jim.
Yes, listen,
Thank
be
you.
well,
Now,
keep in touch.
yes, before we sign off,
Yeah.
Jim has a Facebook page called The Pain PT, and he responds to questions on that.
Yes.
You've also got a YouTube channel, haven't you, Jim? Could
Yeah.
you actually share now with our audience
Yes. I'll go
the
ahead and share
resources
it.
that you provide?
What's
And I mean,
it called?
we provide an overall global resource, but
Yeah.
Jim actually gives you an intense minute-by-minute resource that you can actually hone in on.
Go ahead,
Yeah.
Jim.
So please
What
share
is it
about
on the
that.
YouTube?
Yeah,
What's it
so the
called?
Pain PT, it's across the board the same. The Pain PT have a YouTube channel. It's a lot of free information.
PT.
A website called www.thepainpt, and you can get more information on there. I have a lot of other resources, or if you want additional support, consultation.
Yeah.
And then a Facebook page, like you said. Happy to answer any questions. You can always email me too, jim@thepainpt.com.
I want to address this last question for Patty, because I just got my second win. It's hard. She said it's hard to feel safe with all that going on in the world. And my response to that, and then I'd love us all to three to respond, not to get political or talk about what's going on specifically, but it is very stressful. It's been a very stressful year. It motivated Rose and I and Michael Galinsky to start this, to really be able to help people. And this is an easy answer that maybe will help you. We don't have to be affected by outside external experiences. We are not, the politics. We are not the world. We are not, we are not our pain. This is from Eckhart Tolle. We are not our pain. We are so we can address the outside experiences and know that we're safe. So but that may not be enough for some people. So Rose, how would you answer Patty about that? And Jill's saying the same thing about they don't feel safe in what's going on in the world.
Well, the world is no different to what it's ever been. So the lack of safety is within us.
Yeah.
And, like this fear of death. Well, none of us want to die, but it's inevitable. We don't have a choice. So the more we actually acknowledge that, the safer we'll feel, because we're actually in our body at the moment. And, unless we're in Kabul, we're pretty safe, really, aren't we?
Good point.
Yeah.
I wouldn't want to be in Afghanistan at the moment.
Right. Good point.
But
No.
yeah, but that's fear. That's absolute fear.
Yeah, both those responses are fear. And I would just say what I just said before: if you can be okay with that fear, if you can be okay with that feeling of fear and anxiety in yourself, you're building safety on the inside.
Yeah, on the inside, exactly. Whereas in Afghanistan, it's external. There's people with guns. But in our own inner lives, okay, we've got COVID and we've got the fear of that, but that is a fear. And we've also got a fear when we cross the road.
It's
right. The same fear, isn't it, really? Yeah. So we're dealing with fear every single day of our lives.
So true.
So it's important to actually gather that together so that fear becomes an awareness that, we do have fear, but it doesn't need to cripple us.
Right. It's so
That's
true.
You got to face your fears, because otherwise you'll stay stuck or you'll be pushed back. That's avoidance or flight, right? So we got to face them, because, like I said, a lot of times fear is a ghost, not a monster.
Right.
It's not dangerous.
Right. I would like to share. My purpose. Like, people have a mission and purpose, and we've met a lot of amazing guests that when they had a purpose or a higher mission to heal, whether it was autoimmune disease or chronic pain, they had a mission, they had a purpose. And, I live in Israel, which is a very safe country. And sometimes it's not safe. And I feel like, well, I moved here because I believe in my country. I believe in many things spiritually. I believe in, so it's a higher mission that I'm willing to be in a place that there might be some terrorism, because my higher goal is to be grounded in who I am. And so, Dave Lyons has MS, and he's just got a mission to help people, and other people we have met, So what would you say to that, Jim, about, yes, you're in pain, yes, you have fear, but is your higher mission to be in peace, to have shalom, to have like a good life, to be able to lift your grandchildren, to be able to put the pain aside and say, you're not running my life.
Yeah, that's exactly it. That's a great way to put it. And what I would say is, again, I said that earlier, you got to shift the emotion of fear. Now, it comes from your cortex. You're recognizing that you're feeling anxious or you're feeling fearful. Now, again, I asked that question before. Do you want to be anxious? No. So what's the answer she should tell it? No. No fear. I'm not going to let you control me. So there's a really good response, because now you're coming from empowerment and strength in yourself that you have in you, that you don't need to be controlled by this fear. So talk to it. That's your communication in your brain. It's shifting your emotion from fear to what I would call positive channeled anger, coming out as a form of assertiveness and empowerment and strength. So you're not fighting your fear, but you're standing up to your fear and you're facing it. So you have to face it from a different emotion than fear to overcome it.
Right. Wonderful. Yeah. This has been very, very heartfelt.
Thank you,
for me and Rose and Jim. Just really delightful. So blessed to have learned this. It's recording, so we will get it out to people. And Rose's morning is starting. If anyone has any more questions on the feed, Rose can address it. And thank you so much. Good night, everybody. Good morning, good afternoon. God bless. Bye.
Bye, everybody. Thank you.
Bye.
Bye.
Okay, we're stopping the stream.